Okay, well, Max is going to get into some specific policy challenges that we see coming on the horizon. A couple days after we lost the health care vote and the president signed it into law, he was giving a speech in Iowa City where he said to anyone that disagrees with him, go for it. So I say we take him up on his challenge. And we should go for it. The media and the White House wants to spin the reaction post-healthcare vote as a demoralized grassroots movement and a disorganized Republican opposition. I think the exact opposite is true. I've been on the road since that day talking to thousands of people across the country, and people are definitely frustrated. But instead of going home, they are doubly motivated to show up and hold legislators accountable. We've gone from the potential to do good policy and stop bad policy to what I like to call it the accountability phase of the public policy process.
I'm going to talk about the new pieces of legislation that we see coming over the next several months. The health care bill is obviously passed. There's a continuing fight on that, and as Matt pointed out, these fights never end. It's important to remember that the proponents of government health care have been pushing for it for at least 70 years. So we need to be fighting to repeal it for at least 70 years to do it justice. But I want to look at what's coming up. There's lots of stuff coming up, and everything seems to have a common theme in that it's detrimental to job creation. It involves some sort of taxes or government control in the economy. I'm going to start with cap and trade, or whatever they're going to call it when they decide, whatever they come up with to regulate the use of energy or the emission of carbon.
What is your overall opinion or issues with the tax policy going forward?
Well, I think what we have to prepare for are probably the biggest tax hikes in the history of the United States. That's what happens when you have a massive, expensive new entitlement and the government spending more than it's currently bringing in. We haven't heard a whole lot about it, but the Bush tax cuts that we had over the last decade, a lot of them are going to expire on January 1st, 2011. These are big tax hikes that we'll see. These are across-the-board tax hikes. Remember, in those tax cuts, President Bush signed a bill that brought the 15% bracket, which goes up to about $8,000 of income, down to 10% from 15. That would go up to 15. So that's a tax hike on people earning under $8,000. Brought 28 down to 25. He stepped them all down. Most of the news that you heard about were the top brackets being lowered, but really all the brackets were lowered. We'll have an expiring cut to capital gains taxes. We'll have a expiring dividend tax cut. We'll have the return of the death tax, which this year is 0. Will come back in full strength on January 1st, 2011 at 55% on estates over $1 million. That's a lot of tax hikes. I'd be surprised if even this administration let them all go. I think instead what they're going to do is introduce a brand new tax, and that's going to be the value-added tax, which we don't have in the United States. It's very difficult to track because it's a tax that's assessed at each step of the manufacturing process. Anytime some value is added to something from the minute it comes out of the ground or is cut from a tree, there's a tax that's placed on it. So unlike currently with our sales tax, where at the bottom of your receipt you see how much has been added on to the item that you just bought, the value-added tax is built into the price. So it's harder to get, harder to see, harder to fight, and harder to get upset about, because it sort of looks like inflation. He'll probably start out very small, and he'll do this so he won't have to have all these income tax increases that are set to come actually happen, because people will not like that very much. So instead, he'll put these taxes on, which will hit people that earn below $250,000, which was the level President Obama said he wouldn't raise taxes on people above. He's already done it several times. He's raised taxes on on most people. There were hundreds of billions of dollars of tax hikes in the healthcare bill, for example. Several other bills that he's already signed into law had other tax hikes, cigarette tax hikes, for example, which are regressive. So there'll be this push, I think, that we have to watch out for, this new value-added tax. They have it in most of Europe, and it's what makes the difference between our tax level and their tax level. Not very many people know this, but the average European Union tax level and the United States tax level was about the same up until about the 70s. That's the point when most of the European Union countries started adding a value-added tax. And most of them started small, 1%, 2%, 3%. But they kept increasing them just a little bit, 0.5%, 1% here and there. And now there's a big separation between European Union average tax level and US tax level. But that's because they have to pay for their big entitlement state. We're going to have to do the same thing if we keep passing things like this healthcare bill, where we have a bigger and bigger entitlement state that needs to be paid for with taxes.
Going back to the healthcare bill, IRS Commissioner Schulman yesterday said that, was asked a question at the National Press Club about how they were going to check on who was insured and who was not and the penalties thereof. Do you know what is going to actually happen? You know, there are stories that are out there that saying that there are going to be 16,000 IRS agents hired. You know, what's truth, fiction in this whole regard?
Well, nobody knows yet exactly what they're going to do. The people who voted on the bill don't yet know what they're going to do. We begin now the long process of implementing the 2,700-page bill. That's a lot of law, and a bunch of bureaucrats are going to have to figure out exactly how they're going to implement this. The way they came up with that 16,500 new IRS agents number was they saw in the bill, I think it was the Republicans in the House Ways and Means Committee, they saw in the bill there was $10 billion allocated to the IRS for enforcement of the individual mandate, which says that you have to buy health insurance, otherwise we're going to penalize you. And the way the law is written, it's a tax, and if you don't pay your taxes, then there are other penalties like going to jail, which we heard a lot about during the fight against the healthcare bill. So the Ways and Means Committee guys saw $10 billion for enforcement. Then they figured, well, how does the IRS enforce things? Well, they hire IRS agents who go and enforce. And they figured out what the average IRS person, enforcement agent, gets paid. They figured out that means this bill is predicting about 16,500 new IRS agents. What I saw about the press club speech was that one idea that they have is maybe they'll enforce it by keeping our income tax returns if we don't have our government approved health insurance. These sort of things are going to keep trickling out over the course of the year. This is just one of many of a long line of infringements on personal liberty that this massive healthcare bill contains. And I think that's why President Obama is going to be very wrong about his prediction that we're going to like it more the more we know about it. We spent the last year getting to know more and more about it, and we started liking it less and less the more we found out about it, as we realized that there was this great divide between the president's rhetoric about what the bill was going to do and what it actually did. What he said it was going to do sounded great. What it actually does didn't sound so great. And the more we learned about it, the more we were able to separate the two, and the polling numbers went down. I think they're going to keep going in that direction as we see more and more of these things creep out, as we hear about all these IRS agents getting hired to enforce this law that we have to buy health insurance whether we want it or not.